Hi, everyone. Ready for some more COVID-19 conversations and more with us? My colleagues Emily Shore and Jonathan Jerry are with me, and it must be Thursday because is it Thursday?
I can't tell anymore.
I know the days just fuse into one. Everything seems to be the same except for this virus, which of course keeps us on our toes. And
that's the only thing that's changing over these months is the virus.
Everything is changing. The life isn't what it used to be. And as Yogi Berra said, the future isn't what it used to be. Right. So let's start with a little bit of COVID discussion before we go on to more. And yesterday, of course, a study in New England Journal of Medicine about the vaccine with some optimistic results. And of course, it sent the stock market soaring, I think somewhat premature, but there it is. So let's talk for a moment about the study. This was a phase 1 study carried out. Phase 1 is the first stage of any scientific study where all you want to do is to make sure that whatever you're testing is safe. There's no
in humans.
There's no concern about whether it's effective or not. You just want to find out that it's safe. And usually it is done with a very small number of human subjects. In this case, it was 45. They tried 3 doses of the vaccine, and they tried a booster, and found that there were side effects like you normally do get with a vaccine. Some people got fever, pain at the site of injection, malaise, etc. But they decided that this was not severe enough to prevent any further trials. So the next step will be a phase 2 trial where they will go to roughly 3,000 subjects and test the vaccine. And after that, of course, comes the most important, which is a phase 3 trial, which is a randomized double-blind study where half of the subjects get the vaccine, half do not get it, they get a placebo. And then they are monitored for 2 years at least. So even under the best possible conditions, we're talking here about 2.5 years before we know whether or not this works. But it was the first step, and past the first step, that's where we are. So there is, some degree of optimism because many drugs fail that phase 1. This one passed it, so we will see. But, any expectation that this is going to provide us results in the short term is just not the case. So that's where this vaccine study is. So, Jonathan, you want to add anything to that one?
I mean, only that is just one of about 120 experimental vaccines against this new coronavirus that are being tested. I know there are other vaccines that are a little bit further along in terms of testing, or they're about to start phase 2, phase 3. So yeah, it's all just, who knows? We'll see. I mean, there's never been such a massive focused effort to develop a single vaccine, I think, in the history of humanity. So this is amazing. So even though the rate of attrition and the number of experimental vaccines that do not pass through this series of obstacles, essentially, even though that number is going to be very large, the fact that we have 120 of them gives me hope that some of them should pan out, hopefully, and be safe and effective.
Right. And then people will have to take the vaccine, which is to be, of course, another problem, because we see in statistics today in random sampling that there's a very large percentage of the public says that no matter what, they are not going to take the vaccine.
But I have a question, and I for sure am pro-vaccine, definitely. I mean, look who I work for and everything. But let's say a vaccine all of a sudden within the next month was like, we're here, we're on the market, we're going to start doing some, getting it out there a bit. How does the rollout process happen? Because I have to say, as pro as I am and everything, am I going to be on the first, wave of trial people? Do I qualify under that? I'm a little nervous, I would feel, to get the vaccine, maybe because maybe it's not going to work, or how does it work?
Yeah, but this is not going to happen tomorrow or next week or next month.
Right.
And the phase 3 trial will have 30,000 subjects. So that will give us a good idea.
Okay.
That's what is going on.
But if you want to volunteer and be like an experimental guinea pig, I mean, you can do that on your own time. That's fine.
Right.
And of course, the other problem will be, suppose that one of these really works out, is the production, because we're talking about possibly producing millions of doses, and who is going to get it first? So there are all kinds of ethical questions that are going to arise.
As I think Professor Brian Ward said on our stream a few months back, there will probably not be just a single vaccine. There will be different vaccines. Different countries will have different vaccines, because how can you make 7 billion or 14 billion doses of a vaccine if you need 2 doses per person? I mean, that's a massive undertaking.
Or boosters every year, not boosters, but like the flu shot every year. Just we have to keep getting it.
That would be a massive manufacturing challenge.
Yeah, huge.
Another very interesting paper that came out this week, which really interests me, is because it's about heparin. And heparin is an anticoagulant. It's widely used in hospitals. It's used, prevent strokes and basically prevent blood clots. And it's always been one of my favorite molecules, because my former research director, Arthur Perlin, who unfortunately passed away this year, was probably the world's leading authority on heparin. And he had done a lot of the original research. Now, heparin is a very complicated molecule. It's basically a large protein. But part of that protein matches the envelope proteins in the coronavirus. And there are a number of studies that have recently come out which have shown that heparin can inactivate the virus because it binds to it. And it prevents the virus from using its tentacles, the spike proteins that we see in the picture, that it normally uses to gain entry into cells. Now, these are in vitro studies. In vitro literally means in glass, but it means in the laboratory, in Petri dishes, basically, or in test tubes. But they have found that heparin can bind to the virus. It's the first step. And of course, you have to go to animal studies, etc. But with computer modeling, they actually can show that there are certain fragments of the heparin protein that match the protein in the coronavirus. So interesting possibility. And you can nebulize heparin and inhale it. And there are already trials underway in the US about nebulized heparin in very serious cases of COVID-19, where you don't know what else to do, and the alternative is death. So you basically try everything. So very interesting that heparin, an anticoagulant, now takes on this role. So there's always new stuff that is coming out.
Yeah.
Well, let's launch a little bit into the and more, because there was a very interesting bit of news that came out this week from Burger King. Burger King, of course, is in competition with all the other fast food marketers. And they've already come out with the Burger King Whopper, which is made with the Impossible Burger. It's made with it's a vegan product.
Were they the first ones?
But now they have a regular hamburger made of meat that they say is more environmentally friendly because it comes from cows that do not fart or burp as much methane as normal cows. And cows produce a lot of methane. They of course eat mostly corn and soybeans, and when they digest this in their four stomachs, they release a lot of methane, and it's not an insignificant amount. Animal agriculture contributes a great deal of methane, and methane is a very potent greenhouse gas. It's more potent than carbon dioxide. So cutting down on methane is a good idea. Now it turns out that they've done experiments where they feed lemongrass to the cows, and it reduces the amount of methane that they produce. It reduces by some 30%. But the studies have involved.
That's not insignificant, also.
It's not insignificant. However, to produce enough lemongrass to use it as a supplement in all the cows in the world would be a daunting endeavor. So the studies, of course, so far have been small. They're the pilot studies with a few cows. And you put the cows in what is a respiratory chamber, a sealed chamber. You can measure what they exhale. And you can show that they produce less methane. Now, whether or not this is going to be practically applicable, that's a totally different question because of the scaling up problem here. And so far, I think it makes for some interesting marketing. And it's not that the science is absurd. It's not. I don't exactly know how it works, how lemongrass works. I mean, lemongrass basically has a geraniol, it's the same compound you find in roses. Maybe somehow it inhibits an enzyme that produces methane. I don't know. And the scientific literature so far that Burger King has provided has not addressed that.
But it's very buzzy and very good for marketing. All of a sudden you have a chemical-free, because it's methane-free or methane-reduced. Doesn't even
environmentally friendly burger.
Exactly.
Yeah.
And it's all of a sudden like Burger King's going to save the world.
Yeah. And then I give you another very interesting connection. This article, it was some blogger put this out, but it came out about, I guess, 6 months ago, suggesting that lemongrass is a possible treatment for COVID. And that this supposedly came from CNN, which is not true. This article did not come from CNN. And it was pushed by Dr. Li, who was the doctor who died in China, who originally made the connection to COVID. And that he said before he died that he had come up with a possible treatment, which was lemongrass for COVID.
Really?
Yeah. So what a interesting connection.
That's a bizarre coincidence.
It's a very bizarre coincidence. And I mean, lemongrass, we are familiar with mostly as citronella. That's, the citronella candles and all of this, that comes from lemongrass. And lemongrass tea is also, it's in Chinese traditional medicine. It's a treatment.
It's also in Thai food. In Thai food a lot.
Yes, it is.
Yes,
Jonathan's
a fan of Thai food.
Medicine that are used with no evidence, but this is lemongrass has a long history in traditional Chinese medicine, and you had this comment here about it being used for COVID-19. It's what a bizarre connection it is to methane and cows.
Do you think feeding the cows lemongrass would have an impact on the taste of the burger?
No, apparently, no. They've done that test because the amount of lemongrass that they feed them is very little. So no, you're not going to be able to make lemongrass tea from the meat of these cows. But there are people who are making lemongrass tea, drinking lemongrass tea, thinking that it does all kinds of good things in terms of reducing the infection of the virus. It isn't even clear, actually, that citronella candles will keep mosquitoes away. That's a common belief out there.
Actually, you want to get into that? Why? I mean, I put out citronella candles when I have people over and everything, but why do people think that? What is the connection?
Well, it's supposedly mosquitoes don't like the smell of the complex of chemicals that you get from these citronella candles. Oh,
that's pretty simple. But
we do have an article by Ada McVean on our website where she goes over the evidence for a whole bunch of different ways, alleged and confirmed, to repel mosquitoes.
Right.
Yeah. I mean, there's all the stories that you can ward off the mosquitoes if you eat enough garlic.
And the vampires.
Yeah, but
you're going to ward off a lot of people if you eat enough garlic.
Yeah, I don't know if you're going to ward off the mosquitoes. Okay, something else really, really interesting. Another study here about low-dose radiation and COVID. And this is not as nonsensical as it first sounds. Ed Calabrese, University of Massachusetts, is a renowned researcher in the hormesis effect. The hormesis effect suggests that small doses of substances can have a very different effect than large doses. Now, of course, we're not talking homeopathic doses. We're talking about very small but measurable doses. And he has turned out some studies that very low dose radiation can be helpful in reducing inflammation in the lungs. And there are a number of studies that I've looked at with bacterial pneumonia, where they use very low dose radiation and it clears up the pneumonia. Now, no one has so far done these studies with the viral pneumonia, which is, of course, the issue with COVID. But again, there are studies now that have been launched in the US with very seriously ill COVID patients. And interestingly enough, they are their own double-blind trials where they irradiate one lung with low-dose radiation and not the other to see whether or not there is a benefit. So we will see. It's a very controversial area because there are people who say that the risk of inducing cancer, but this is being used only at the last resort, where chances are that the patients would. So at first, it may seem ridiculous that you can treat viral pneumonia by exposing the patient to low-dose radiation, but may not be so. Sometimes things that at first sound silly turn out to be real. And that's, what we're seeing now is that every possible avenue is being explored with COVID, because so far there's nothing that works. So when nothing works, you resort to trying everything.
Although I did see, yes, for sure, there was something about masks. I think it was in the New York Times today, basically saying if everyone adhered to wearing masks within the next 4 to 6 weeks, COVID could, not 100%, but I was going to say it would substantially decrease the spread and everything. And maybe we could just talk about this, mask controversy, which it's totally not a controversy. So, it shouldn't be a controversy, hence my air quote. And the anti-maskers, and how now, in Quebec, everywhere followed Côte St. Luke's. Remember last week people were saying, do we think Quebec should follow suit? And now they are following suit, and then there's a 2-week delay or time. But
it's really quite ridiculous how in the U.S. it has become a political issue. That wearing a mask is somehow an unmanly thing to do.
It's like ideological and political. It's
Of course, we don't have concrete evidence that everyone wearing masks everywhere is going to solve the problem, but it's not going to do any harm. And you got to try. You just have to try everything. With the rate that it is spreading in the U.S., it's absolutely terrifying.
Yeah, but what we are seeing, as Emily points out, is the challenge of public health, which is the population accepting to do something that they may not want to do. And so even if you have the best evidence in the world, if enough people say no, I'm not going to do it, then it's not going to have the impact that it should have.
Absolutely.
It's almost like a little kid, I think, having a tantrum, or that they're not going to do something their parents tell them to do simply because they told them to do it. That's how I, despite the evidence or despite the lack, it's for the human good, right? But someone saying no because you told me to, I'm not going to, and I need to. It boils
down to values. There are some of us who value compassion and helping other people in society more. There are other people who value their personal freedom more, and that's what we're seeing is this disparity in where people place their values.
Well, you saw
no one's going to tell me whether I can buy a gun or not. No one's going to tell me whether I have to have health insurance or not, even if it's good for me. No one's going to tell me if I can wear a mask or not. And unfortunately, there's a large percentage of the population, mostly in the U.S., who feel that. There's too much government intervention, and government is going to tell me what to do. And unfortunately, there are some people who should know better who are in that camp. Ronnie Jackson. Dr. Jackson, who is Trump's former physician, was on TV last night saying that he doesn't think that there's value in wearing a mask. And this is a physician. And then, of course, we have this absurd thing about Dr. Fauci, mounting criticism.
I feel horrible for him. I feel all of a sudden that he is totally being attacked. And in all of his years, he's not a political appointee or anything. He's just doing his job and looking out for people's health. There was a quote yesterday that people were posting on Instagram by him saying, I think it was, it's very hard for me to teach just how to care for other people. That's all he's trying to do, right? Wear a mask.
Well, this editorial that sparked this whole thing in USA Today by Peter Navarro, Trump's henchman,
right,
who is a scientific nobody. Nobody. In fact, he's worse than a nobody. He has negative scientific knowledge, right? And he writes this ludicrous editorial about how Dr. Fauci has been basically wrong about everything, that, nonsense. Now, of course, it turns out, no matter who you are, how good a scientist you are, that with complex situations like this, when you don't yet have enough information, you might say things that eventually don't turn out to be right. No one can know what the future is going to be, so at the beginning, there wasn't this emphasis on the masks because there wasn't enough evidence for it. But the fact is that essentially everything that Dr. Fauci has said has been correct. And even where they say that he's been wrong, they've taken his statements out of context. They didn't reproduce the whole statement. They took little bits and pieces of it. It really is absolutely nonsensical. I mean, it goes on and on. Like, that once I get started on Trump.
I was like, but
I tell you, listen. I mean, this thing yesterday with the beans, and it ties into what we're talking about with the cows, right? The cows produce a lot of methane. Well, humans also produce, methane and other gases when we eat certain foods, especially beans. Trump's diet, as we know, is not a very good one. He lives on hamburgers and Diet Cokes, apparently about 12 a day. But what's it got to do with what we're talking about here? Is because a few days ago, the president of the Goya company, this American company that produced a lot of canned foods, basically
legumes, beans, yeah.
And he made some very complimentary statements about Trump. And of course, that's, it's a very good thing to do, right, in the Trump world. But in the non-Trump world, this initiated all kinds of criticism and calls to boycott Goya, which I think is also a bit of an extreme. I mean, just because the president likes Trump doesn't mean that you need to boycott the company. However, where this becomes, a cartoonish situation is that we have Trump posing in the Oval Office at the Resolute desk with Goya products in front of him. This is the President of the United States basically commercializing a product.
It looked like an SNL cold open or something.
I mean, it's unethical at the very least. I mean, it's absurd, but it's certainly unethical.
We're way past unethical when it comes to Donald Trump.
It is. The only thing that we can say is that I hope that he eats those beans, because that will make a lot of stuff come out of him, and that stuff needs to come out. Yeah.
So we have a few questions on Facebook, but also I was wondering, and I know, Joe, you did a video for the Gazette about this and talking about the Spanish flu, but I was thinking about it yesterday and about the seasonal flu, like, the flu shots that we get every year. And I thought, we all are comparing this to Spanish flu and a second wave that can come bigger and worse in the fall. And we could talk about the realities that are starting to, come with that September coming up. But what happened? Like, how did the Spanish flu, how did we get through it? Like, how long did it kind of last? Is the modern flu vaccine a vaccine based from that? Like, how did...
No vaccine. Incidentally, you know that Trump's grandfather died of the Spanish flu?
Yeah, I didn't know that.
1917, he died of the flu. How many people died is somewhat up in the air, 25 to 50 million, and at least 25, but somewhere between 25 and 50 million. No, there was no vaccine at the time. There was essentially no treatment, aside from the kind of things that we suggest today. They did wear masks. Right. They did realize that transmission indoors was worse, and they held church services outside. So a lot of that parallel we are doing today. But they had no treatment. There were no retroviral, no antiviral drugs. There's no remdesivir, and oxygen therapy was not possible either in those days on a large scale. Many of the patients eventually succumbed to secondary bacterial pneumonia, because there were no antibiotics. So I don't think we're looking at quite as catastrophic a situation. But eventually what happened is herd immunity.
It did. Okay.
Enough people died, and when you have enough people die, and the ones who don't die and have survived the virus, they have immunity. I think that's what happened. And eventually something will happen here too, in that vein.
What I also find crazy is that as much as we compare this to then, there was no technology, so they couldn't even. There was no news or social media or any media to even inform people that people are getting sick. And
there were newspapers, Emily.
There were newspapers, yes, but the speed and rapid pace. Look at how our information evolved within from the March 11th to March 16th or whatever. People couldn't really know, don't maybe be around people. All the speed was
but everything was slower. Scientific research was slower. There were fewer scientists, and so everything was slower. And misinformation also was slower. I haven't seen so much misinformation about a single topic in my short career. They didn't have that back then. They had a lot less misinformation, so everything was slowed down.
Yeah.
And also, a lot of the deaths were in the military, because this was, of course, during World War I.
Right.
And when the virus hits some installation where you have thousands of people, close together, it spreads like wildfire. So, yeah. So I don't think we're going to approach 25 million dead here.
Let's knock on wood.
But still, we're looking at a pretty bleak situation, because this is not going to be over by the end of this summer. We're going to go into the winter, I think, with this. And piggyback on this will be the flu virus.
Oh, yeah, for sure.
So I think it's very, very important to emphasize flu shots, because although, of course, they don't help with the coronavirus, but for sure, getting the flu and the coronavirus at the same time.
Well, and what it's going to do for our hospitals also,
Well, this is the real concern, overwhelming hospitals, which is, they're seeing this right now in Florida and in Texas and Arizona.
We're going to have
no critical care beds left.
We're going to have Dr. Zlotnick come back in the next few weeks or so to talk about Israel's situation, because as good as they were in shutting everything at first, they were a lot less vigilant in reopening. And as you can see, even from
there was the reopening of the schools, and now they agreed.
Right.
Schools were reopened too quickly, and this is what happened.
And that's also, we're looking at here for the fall. I have some friends in administration of schools, and even though they're preparing, they still don't know if it will, come time September, what it is going to be actually. And then even if they open, they're going to have to close again. And so in the States, they're facing the same thing. However, Trump is putting
the only thing we know for sure that we are going to be online in September. McGill is not going to have any live classes in the first semester. And I think
probably the second semester too.
I think probably the second.
Yeah.
If you're a big person, I think that would be the way to bet. Harvard, of course, already has said that they will do the whole year online.
But now they're facing some backlash now with the president. We don't.
Well, they're facing backlash. Although the president now has gone back on this idea that foreign students.
Oh, he did. Because there was a class action lawsuit.
Right. He wanted to essentially say that any foreign student who's registered at a university where the course is online has to leave the U.S. and go back to where so that now they have abandoned that. It's also, this business of, his feverish action to open up the schools is also political. He thinks that this is not going to help him win the election. I'm not sure exactly how. He thinks that this is tied in, but I think that's
Look, the economy does have to reopen, and we do have to learn how to coexist with this virus. However, if the people's health and public health were on the same level as the economy reopening, and the focus and priorities were a little shifted, we would be in a different situation, I think. But can we let's take maybe a look at some questions on Facebook, and then I know that we have another interesting topic, non-COVID, to talk about with Jonathan. But just again, with looking at the masks, face shields versus face masks. Do face shields even really work? There's so much air coming out of the sides. What's happening?
Well, what face shields certainly do is prevent anything from going through the shield. So in the cases of a dentist or doctors, who are in the hospital where you have a lot of aerosols.
Estheticians also.
Estheticians, yeah, where you basically are worried about people spitting on you, right? There, of course, it works. But obviously in the situation that we mentioned, they also wear a mask underneath the shield, the dentists and doctors. Because as you said, there's a large opening, of course, around the shields. Things get in. It's hard to know whether, what the relative risks are with just a face shield or just a mask, because that really hasn't been studied. I think the trouble is that it's hard to go through a whole day. Let's say you're a teacher in a school, to go through a whole day wearing a mask. It
is hard.
It's hard. So there, the face shield might make it easier. You can speak easier, you can breathe easier. There are pros and cons for both of those, but when it comes to blocking micro droplets, the face shield will do that.
Yeah, I also find with certain face masks, some really cover a good part of the face, and others, like I have one where I open my mouth and then it goes under my nose, and then I keep fidgeting with it, and I'm going to reorder a better size because there's no point.
Of course, there are a lot of people who think that you breathe through your chin. Right.
Yeah.
Walk around, you see the mask pulled down there, and then fidget pulling it up, probably doing more harm.
Or they go up to somebody to talk to them and they pull the mask down so they can hear them better. It's like kind of defeating the purpose of wearing the mask in the first place.
And there's also the mask etiquette, and I'm not talking about mask etiquette in terms of wearing them, but in terms of when you see someone wearing it the wrong way, I also don't want to be the mask police. Like, I don't want to be like, excuse me, just so you know, you should have your nose covered. And I really could do that, right, if I do it nicely. But then I don't want to be, I don't know, I don't want to be the police on that. And that also brings us into the bus drivers here. Now you have to wear them on masks on the bus, and going into stores soon in about 2 weeks. And the whole question has been, are store owners or our bus drivers, who's policing the mask? Because it's one thing to kind of say it and hopefully they do it. If someone puts up a fight, and if I was a bus driver, I would not persist anything, because you've seen some stories where bus drivers were getting beat up.
There are dozens and dozens of YouTube videos on exactly that, where people go into a store and refuse to put on the mask and are confronted by the salespeople, and it often leads to ugly situation, and it always comes down to this business that, I have the freedom to do what I want and no one's going to tell me, and God gave us the breath to use, and it's you're going against God by wearing a mask. Ludicrous things like that.
Yeah, well, their God also gave them the coronavirus. So
right. Someone said in the chat, those types of people who don't want to be told what to do or taking away their agency, everything else is shut down and controlled, and this is opening this, and you have to do this, and there's rules. So this allows them that freedom to choose, and they still feel that they have some form of agency.
This idea that you have the freedom to do whatever you want under any situation is just not true. There are many things in life